Many people think that all heart attacks happen just the way you see it in the movies. Imagine that kind uncle from Anne of Green Gables. It's usually a man because heart attacks only happen to men, right? He clutches his chest, it's dramatic and obvious. Some people do experience the classic Hollywood heart attack, but the truth is, heart attack symptoms can be more subtle than what you see on the screen. Whatever the symptoms, this much is certain. Heart attacks damage heart muscle, and heart muscle does not recover. The damage is permanent. Hi, I'm Dr. Srivastava. I'm an Interventional Cardiologist and Director of the Vascular Medicine Program at the Florence, Wormald Heart and Vascular Institute at St. Elizabeth. I take care of patients having heart attacks every day. Of any situation where timing is everything, this is especially true with heart attacks. If you think you or a loved one may be having a heart attack, the most important thing to remember is this: call 911 immediately. Do not drive yourself to the hospital. In this session, we're going to explore the signs and symptoms of a heart attack. The answer is sometimes. Sometimes a patient will have a kind of stuttering chest discomfort on and off for a few days before a heart attack. But many times a heart attack comes out of nowhere. A person's fine one minute and having a heart attack the next. Chest discomfort's not usually a sharp or stabbing pain, but also not a fleeting pain. It's more of a pressure central in the chest and usually lasts for a few minutes. It lingers. A person can also experience pain or discomfort in one or both arms, the back, neck, or jaw. Shortness of breath, breaking out in a cold sweat, nausea, or lightheadedness are all classic symptoms of a heart attack. But many people have a heart attack without all these things happening simultaneously. It's also concerning if these symptoms happen during an activity, like walking or moving around. The most common heart attack symptom for both men and women is chest pain or discomfort, but women are more likely to have unusual or atypical signs of a heart attack. Sometimes it could be nausea or just not feeling right. Women can experience extreme fatigue. They're suddenly exhausted and want to lie down. It comes out of nowhere. Women are just as likely or more than likely as men to have a heart attack, but it's underdiagnosed and undertreated in women, and we have to work to close that gap. It's important to listen to your body. If you suddenly don't feel well and something's wrong, get checked out. Call 911. Do not drive yourself to the emergency room. Do not have a family member drive you either. There's a saying, time is muscle. If you're having a heart attack, the longer treatment is delayed, the more heart muscle is permanently damaged. The sooner you get medical hands on you, the better the chance of survival. Calling 911 is like bringing the hospital emergency department right to your door. Emergency personnel arrive fast and can start treatment right away. They'll do an EKG right on the spot. A heart attack can lead to sudden cardiac arrest when the heart stops beating. Emergency personnel have equipment to restart the heart if that happens. Emergency personnel can also send information about the patient's condition directly to the emergency room before they even arrive at the hospital. This sets in motion a whole chain of events to alert the care team at the hospital. A person can go from their living room to being on a procedure table and having an artery opened with a stent in under 90 minutes. It's human tendency. We don't like to assume there's something wrong. There can also be fear of uncertainty or of being embarrassed. People may confuse heart attack signs with symptoms of a pulled muscle, indigestion, asthma, or the flu, and decide to wait it out. Some people don't believe they're at risk for having a heart attack. They'll ignore warning signs or wait to see if they get worse before getting help. Many people think heart attacks happen the way you see in the movies. Women delay especially. First, they may not feel the common symptoms of a heart attack, and second, they may have responsibilities and feel it would be an imposition on others to stop everything and get medical care. CPR stands for cardiopulmonary resuscitation, an emergency life-saving procedure used when someone has had a sudden cardiac arrest. Hands-only CPR is CPR without the mouth-to-mouth rescue breaths. Studies show that hands-only CPR is just as effective as conventional CPR when given in the first few minutes of a cardiac arrest. If you see a teen or adult collapse, the urgent things to do are call 911, check for a pulse, call for help from people around you, have someone search for an automated external defibrillator, also known as an AED, start CPR, push down hard and fast in the center of the chest in 2-minute cycles, essentially to the beat of the Bee Gees song Staying Alive. Even if you don't know CPR, it's better to attempt it while waiting for the ambulance. Stay on the line with the emergency medical service to talk you through what you need to do. Many places in the community offer CPR classes, including St. Elizabeth Healthcare. An AED is an easy-to-use medical device that analyzes heart rhythms and delivers a shock, if necessary, in a person whose heart has stopped. Automatic external defibrillators, AEDs, are in most public buildings: churches, stores, malls, government buildings, community centers, grocery stores, airports, trains, and schools. The AED gives you step-by-step voice instructions. It will tell you how to check for breathing and a pulse, and where to position the electrode pads and stickers on the person's chest. When the stickers are in place, the machine measures the patient's heart rhythm and determines if a shock is needed. If it is, the machine will instruct the user to stand back and push a flashing button to deliver the shock. You'll resume CPR after the shock is delivered. The AED will guide users through CPR. The process can be repeated as needed until the emergency team takes over. Yes, the machine guides you through what's needed. Of course, it's a traumatic and scary event, but the machine is very clear about what to do. Thank you for taking the time to learn the dangers of delaying medical care if you or someone you love thinks they're having a heart attack. Heart attacks can be scary, but not getting immediate care can be scarier. Check out the other segments from the St. Elizabeth Take Time for Your Heart program to learn more about how you can get your heart health on track.